Yes, he did. Donnybrook is made possible by the support of the Betsy and Thomas Patterson Foundation and the members of 9PBS.
Thanks for joining us for this edition of Donnybrook. We really appreciate you inviting us into your homes or wherever you are. And we've got lots to talk about on this edition, but we're also going to talk to Clay Dunagan from the St. Louis Pandemic Task Force and the Chief Medical Officer with BJC, who will join Wendy and Bill for Next Up on the second half of this program. There she is, the news director for the Big 550 KTRS and the co-host of the Jennifer and Wendy Show, Wendy Wiese, along with Mr. Bill McClellan from the St. Louis Post-Dispatch. He's Ray Hartmann from rawstory.com, the Riverfront Times, and the Big 550 KTRS, and the news editor from the St. Louis American, Mr. Alvin Reid. We're going to start with you, Ray. Since we met last week, both the city and the county announced mask mandates. We could probably parse that word, but as of 8 o'clock on Monday morning, all individuals 5 and older are required now to wear a mask indoors in public spaces. And since then, the St. Louis County Council, in a real Donnybrook, voted 5-2 on Tuesday night to rescind that mandate. What was interesting, there were 2 Democrats who sided with the 3 Republicans. And one of those who ended up not voting to rescind, Kelly Dunaway, told you on your program that Rita Hurd Days and Shalonda Webb are not really Democrats. Is that a fair characterization of what she said?
It is. I don't concur with her, but it is what she said. And I will say this, that none of us enjoys wearing a mask, but this is really a national travesty we have, that we are talking about this as a human rights or a freedom issue. It's about civic duty and about understanding common sense with regard to our health. And of all the things we differ on, the idea that we can't come together to try to minimize this pandemic, because you do not have a civil right to endanger other people's health. You just don't. There's no basis for that. I would have voted for the mandate. I think it does show that Sam Page, the county executive, has I think his arrogance, quite frankly, in dealing with the St. Louis County Council is something he's paying a price for now.
Well, I would say, Ray, on that one, as far as Rita and Shalonda are concerned, yeah, they think he's arrogant and maybe should have done that. But that's no reason to vote against, the mask regulation, because you got a political beef with Sam Page. And I think that's the only reason that they voted that way. And I think that's shallow reasoning. I quite frankly, I don't know if I'd give thumbs up or thumbs down. I probably would have decided that after when it came time to vote, because I'm still kind of torn on it. But I think they were being driven not by procedure, not by they don't think there should be a mask mandate, but by let's stick it to Sam Page. And that's just not really a good thing at this time.
I think there's a lot of good arguments to be made against the mask mandate. I mean, it's counterproductive. If you really want to get people to get vaccinations, telling people who are vaccinated that now you have to start wearing a mask again, I think it would be better if we just had all the restaurants, like the smoking ban. If you want to let people into your restaurant without vaccination cards, fine. If you want to say you need a vaccination card to get in here, fine. That'd be a lot more effective than a mask mandate. I'm not enthused about that.
Well, and let the employers also take matters into their own hands. Facebook has said, look, if you want to work at Facebook, that's great. You can criticize Facebook on Facebook, but you still have to have a vaccination. I agree with you. I think a mask mandate just sends the wrong message, and it punishes people who have been doing everything that they can to mitigate COVID and the Delta variant and whatever comes beyond it, in favor of people who will not, they're not going to get the vaccine. They're not going to abide by the mask mandate, and they're not going to help anybody out when it comes to herd immunity.
And I think
I completely disagree with you guys on this. I have to tell you, I do not think the vaccines and the mandates have anything to do with one another. And the idea that people are saying, and this is all over the country, people are saying, you told me if I got the vaccine, I wouldn't have the mask. It's like a 5-year-old that you tell at home that if you clean your room, we're going to go to Ted Drew's. And then you look outside and it's a tornado. And now you try to explain that things have changed. In this case, the tornado is the variant. And so the idea that as somebody who got vaccinated, I do not feel taken now that I have to wear a mask. It's no big deal.
Nobody does, Ray.
Right. But like I wear a mask when I go to a store out of courtesy to the employee.
I'm always going to wear a mask.
I don't know
what? So what's the worry about it then?
Sam Page is going to tell me that, I know you've been vaccinated, but you have to wear a mask. And then the people who aren't vaccinated goes, well, the vaccines must not work well. That's not the message we want. We want people
nonsense
to get
that
Do you know what, Ray? I don't think they were sticking to Sam Page because Shalonda Webb in a press release that she sent out, she pointed out she is in favor of the masks, but it's a procedure, and she doesn't want the county executive bypassing the county council. And in fact,
that's what I was saying.
When it was brought up, they said that they would vote for it.
Tim Fitz told me that. Tim Fitz just told me he'd be for a mask mandate. They don't like the process. That's what I was talking about.
That's fair.
The arrogance. But I don't agree with their vote, but I understand it because it was about the process.
Okay.
The irony here, though, with Sam Page, who always criticized Steve Stenger for the exact same behavior, is so thick. It's funny.
Yeah, well, this is kind of like, let's not. I'm mad at the procedure we came up with to build the dam, so let's not build the dam, and so we all just get flooded right on out. I mean, that's nose Spidey face right there.
And by the way, it's not a mandate, Charlie. I mean, you made reference to that.
Correct.
And it shouldn't be. One of the things I think people are confusing it with, I know Eric Schmidt, of course, trying to jump on the pile, is with a lawsuit that's, I don't think it'll go anywhere. There's a distinction between a shutdown, an economic shutdown, which I would be against, and a mass. Really, it's a strong suggestion. It's not really a mandate.
Well, that's most interesting that you raised that, because the county councilor told members of the county council in a closed-door session that she would be going after individuals, but the health director told the county council that they would go after businesses. I don't think they're going to enforce it at all, to be honest with you.
I don't either.
Because some mayors have said they're not going to enforce it. Other mayors have said, well, we don't enforce those rules anyway. It's always the health department. So I'm not. I'll tell you what, my wife went to a club today. Half the people, including employees, had masks on. Half did not. I think St. Louis is completely confused, in the county anyway, whether there is a mask mandate. But Bill McClellan, Faisal Khan, who is the health director for the city, appeared in front of the board this past week. And it was a very lively session. He spoke to the county council on the way out. He did flip the bird, an obscene gesture, but then he wrote a letter claiming that the first question to him, asking about his credentials, was a dog whistle. He claims that on the way out, he was shoulder bumped and assaulted, his words. He made other claims as well. Do you think there should be any discipline against him, or should there be a police report on the incident? Should people be investigating this? What do you think?
Well, I don't know. And I think that Dr. Khan was wrong to give anybody the finger. I think he should have a little more decorum about him. But I thought that Tim Fitch was way beyond the pale. And I liked him, and I spoke at his retirement dinner. But when he asked Dr. Khan, can you tell us why they call you doctor? Are you a licensed physician in the U.S.? And then later said, he doesn't understand where Dr. Khan is coming from, saying that this was a dog whistle. I mean, Tim Fitch is a smart guy, and he knows the MAGA people, and he knows how they respond when he starts asking about, are you a physician in the U.S.? He knows he's holding up Dr. Khan as one of the others. And I think that was a wrong thing to do. If you want to be against the mask mandate, fine. There's good reasons for it. But going after ethnicity is beyond the pale. And I was disappointed in Tim Fitch, who I generally like.
Well,
I hate to. Go ahead. Go ahead, Charlie.
No, he on my program this morning, he pointed out that there were times in the past when the acting director, Spring Schmidt, couldn't sign health orders, and instead she had to allow Emily Duchette of the health department to sign them because Emily Duchette is a medical doctor. And Fitch was pointing out, he was just wondering what the credentials were because this most recent health order was signed by Faisal Khan.
If Tim Fitch wanted to know if Dr. Khan can sign a medical order, he could ask, Dr. Khan, can you sign a medical order? There's stuff about, are you a licensed physician in the U.S.? Why do we call you doctor? To a MAGA crowd. People understand who the MAGA crowd is and what they're about. And I think that Tim Fitch is being a little disingenuous saying that.
Agree.
By the way, I'm fine with Dr. Fahn flipping him off. I think the abuse he was subject to. I feel like we're having whether we like it or not, we're sort of in a knife fight right now politically in this country. And my side's got to put down their spatulas as far as
Can I make
I
one?
have no problem at all with him flipping him off. Admittedly, that will be what makes news. And I think good for him. He took I don't know the other stuff, but I will say he took a bunch of abuse. And I don't want to be hearing about how just because they're taxpayers that they get to heap with Mark McCloskey in the front row, by the way.
Once again, if a unruly crowd was coming to the city council meeting, not to be violent, but to be unruly, and that group of people were not white people, this never would have happened, okay? Because the place would have just been like, a siege with police officers.
Well, no,
it cleared out. As soon as people got abusive and shouting, they'd have cleared the gallery.
Great point.
I don't think that's true. In fact, I can recall I disagree completely. In 2015, that happened again and again in Ferguson and in front of other legislative bodies in this area around the country.
I'm talking about the county. I'm talking about, Charlie, I'm talking about the St. Louis County Council. I'm not talking about Ferguson, and I'm not talking about wherever else in the United States of America. Okay. I'm talking about the St. Louis County Council.
I will say this.
That's all I'm saying.
There are some inconsistencies with Mr. Faisal Khan's statement. He claims that he was shoulder bumped and assaulted in the aisle on the way out of the chamber. And the video of Channel 5 shows that was not the case. He was escorted by a police officer. I guess we can ask that police officer if he was the victim of racial epithets. He claimed that Tim Fitch is a friend of Mark McCloskey, and they're both MAGA supporters. Actually, Tim Fitch had never met, never talked to, never texted, no communication ever with McCloskey. But that's another thing, because the early reports, there was Channel 4 there, Channel 2 there, Channel 5 there, the Post-Dispatch, KMOX, none of them reported the racial epithets or the assault. Even Rita Hurd Days or Kelly Dunaway, they never reported about any racial epithets or making fun of Dr. Khan because he resembled a Simpsons character or anything like that. None of that came out until this letter.
I hope he does not lose. I hope he doesn't lose his job over this, but I hate to see somebody, and even though he is not an elected official, he is a man of science. He is a man of letters. And I think that men and women like that command a certain amount of respect. And I hate to see him lower himself into the mud in a setting like that.
If you listen to a transcript, if you listen to the tape, you will notice that the chair, Rita Hurd Days, did tell the audience to be respectful, but her harshest language was for him and his behavior.
He said that. Let me say this. I wasn't at the meeting. I'm not really interested in seeing. It's
all posted online.
I get it. I somehow I can't believe that he just made it all up. it's possible, but I doubt that he made up that he was subjected to slurs.
There are cameras in the government center, and there's also there are probably 8 police officers there, including a gun
I don't think it's really.
And when he quits and moves to another state, which I guarantee a lot of people are doing in this our great show me place here. All right, what he will tell people is that, you know what? Instead of people actually defending me, they tried to figure out a way that I was lying.
Right.
For this group of people. For
why
that
wasn't
group
it
of people.
reported? Did your newspaper report?
You know, like for that group of people, you're lying. There is no way that those God-fearing, good old guy and gal Americans would ever do anything like that. He must be lying. I mean, it's just that's just so St. Louis.
Charlie,
I'm just saying, Alvin, why wasn't it reported till the letter came out? If the place was full of media,
I don't know. You tell me. There's a lot of stuff that doesn't get reported in St. Louis when it comes time to.
I will say, does anyone on this panel find it the most unusual that Mark McCloskey was in the front row or the second row?
I don't.
And that wasn't even reported by the news media.
Well, if they didn't report that, why would they report the other stuff? Yeah, here's the deal, Charlie. The news. I don't really. To me, this story's kind of over. I think it played itself out. Faisal Khan made the statement that I think was in its own way. I know it's not perceived on this panel here as his own elegant answer to them, which is to give him the flipping the bird. I don't believe he made it up. I will say this about him. He was here before, and he was the first guy that as a health director who really made sense about Westlake and about Coldwater Creek and did some things that made sense in terms of how he reacted to it. And so I think it's going to be really sad and I think he will end up packing his bags here for the reasons Alvin said. And I think that we don't need to spend money on an investigation and criminal this, criminal that. I think it's sort of the story's over. He flipped them off. Let people decide what they want. I mean,
so now it's
I'm not sure where investigation. I mean, this is happening everywhere. Yeah. And you know, fortunately or unfortunately, it's not just a St. Louis thing. But Ray, I think you have to have a little dignity when you're a health director, and the idea of flipping people off. Ha ha ha.
Okay. Let's
move
on. So now it's Michael Nydorf, Vladimir Tarasenko, and Faisal Khan, who might be moving out of town. Alvin Reid, Jay Nixon, the former governor and a Democrat who has shown the ability to win statewide, has announced he is not going to run for the U.S. Senate seat that's being given up by our senior senator, Roy Blunt. All right. How about a little prognostication analysis? Tell me, where's this race right now for Democrats and Republicans?
Well, first of all, I can say that I've seen the former governor, Jay, a couple times over the past year, and he looks like a different guy. I mean, not that he looks unhealthy during his political days, but he really looks, I just have to say, better. So what he said, you know, in his statement about, you know, I'm really healthy and I'm really liking my life right now. I think he's telling the truth. Now, where we go from here democratically, I don't know. I don't know who steps up and maybe wants to run, but somebody will. And I think, you know, depending on who gets the Republican nomination, that somebody could have a real chance to win.
I think he's smart enough to see that right now the political process is pretty unappetizing for somebody who came along when he came along. I think he still has political aspirations, and he's going to wait and see how the midterm and the general, the next couple of races shake out. I don't think we've seen the last of Jay Nixon.
I actually think we may have, but who knows what's in his head. I will say this: CNN has Missouri, believe it or not, it's just one assessment. It's the 10th, ranking 10th in being a state that could change hands. And I know we all kind of have come to see Missouri as pure red because of the last few cycles, although as recently as 2014, all but one of the statewide candidates was office holders was a Democrat. I think that the key to the Democrats right now is that the Republicans are in danger from their perspective of having a very, very weak candidate. And right now, I guess Greitens is still the favorite. And he would be a very, very weak candidate, very beatable. I keep talking about this guy, Lucas Kuntz.
I thought
Lucas
Schmidt was
Kuntz,
polling.
the guy I've been writing about, raised 600 grand in the second quarter. He is not to be underestimated. He has if you look at his Twitter account, every day he's hammering away. Admittedly, he's a bit progressive, but he's got the military background and intelligence background. The guy is not to be underestimated.
Very well.
I don't care what CNN says. This is a Donald Trump state. Yeah. And if Donald Trump whoever Donald Trump endorses in the primary is going to be the Republican nominee, and I'm afraid will be the next senator.
Wendy Wiese, I want to ask you about voters in the St. Louis Community College District who are being asked to increase their taxes next week. Even though the college has a declining enrollment, it's down 35%, and yet we know education is the key to success. If you want people to succeed, they need to get educated. So where are you going to stand on this tax increase?
Well, I think after reading Tom Sullivan's, the case that he made, the taxpayer watchdog, his case against the 40% property tax increase, I wouldn't want him ever coming out against something I supported, because he made his case in a very sharp way. A 40% property tax increase, as you said, Charlie, while enrollment is declining 35% in recent years, and 19% of people are having trouble paying their mortgage, especially in light of the fact that one of the president's top focuses, or one of his top areas, his priorities, is a free community college, a gift to the students of America. So that would be a windfall. I don't see that that's and especially because they don't have to say anything about how the money is going to be spent. So I agree with Mr. Sullivan, and I would vote against it.
I would probably vote yes, and that's only because Wendy's house is probably 3 times as large as mine is, so my 40% is probably less. But one of the things that we're hearing from unions and businesses and universities are that our workforce is not educated enough, and if we are going to start getting there, the key is to get people into junior college, that can't afford to go to immediately to a 4-year college. So I think it's one of the steps in trying to, improve our region. And also keep in mind that this also includes Jefferson County Community College and the one
in Franklin, I think.
And Franklin too. So this is a region-wide kind of deal for those that, think, we're just giving free college to those folks up there in North County, and so it's region wide, and I think I would have to say yes on it.
Me too. I mean, wouldn't it be great to have a terrific community college system? I mean, Tom Sullivan is against all these things, and sometimes he's right. But on this one, it's hard for me to ever vote against education.
Well, I'm with you, and I think, Alvin, you really stated the case for it well. I had Tom Sullivan on my show, and I will say this. His arguments against it are really good arguments. I mean, particularly about the timing of it with regard to the pandemic and how that's hit people who are real estate property tax. At the end of the day, I'm a lot less of an enthusiastic yes than I normally am on these taxes. But I think Alvin's point about the regional solution and the fact that, to Wendy's point, we can't really wait to see whether that community college thing is going to happen.
Very good points, everybody.
And
everyone.
So I'd be for it.
I will say, like many of you who have traveled around from high school to high school to see high school sports with your kids, you do notice that some high schools are in much better shape than our community colleges. I've noticed that. Hey, I do want to say this, Bill McClellan. We had another disturbance, the 4th in 2021 at the downtown CJC, City Justice Center, the jail. And it turns out officials are telling Joe Vaccaro, who heads up the Aldermanic Public Safety Committee, that the locks and then in the cells will not be repaired till the middle of next year. So that's 18 months away there. Meanwhile, a report in your Post-Dispatch, the detainees are going hours away because there isn't enough room for the federal detainees. They're being sent to Kentucky and Indiana, and their families and lawyers can't access them. I think an outside consultant should come in, but you talked to the Sheriff Vernon Betts this week, didn't you?
I ran into Sheriff Betts, and he made a couple of really good points. I mean, one, he was saying everywhere else in America, the sheriff is in charge of the jails, but not here. And we were just talking about the general situation, and he said that he thinks we should have kept the workhouse open and used it just to house federal prisoners. And that way the city would be getting money from the feds, and these prisoners wouldn't be going to Indiana and Kentucky, and their families can't see them often, and their lawyers have a hard time seeing them, and it would make more sense for them to be at the workhouse. And I thought, what a good point.
Charlie, my biggest problem maybe with the consultant is, well, one, I'm kind of hesitant on the whole consultant thing, but I think lo and behold, they come back and they say, like, you know what you need to do? You need to privatize your jails. And that's really frightening to me. And I think that's probably what what they'd come up with.
But you know what, Alvin? I mean, I think for a lot of people, and you're absolutely right, privatization has become a lot, much less of a terrifying idea when we see what we're seeing now at the Justice Center, and with the closing of the workhouse and this dispersal of prisoners. I mean, but when you say consultant, we all think of Alvarez and Marcel, and I hate to go down that road again.
I think privatization of prisons is a terrifying idea and remains so. But although with respect to the Alvarez and Marcel references,
that was terrorizing.
That kind of wins the day.
I supported that in the beginning.
I like that reference. I think that's a good.
Well, I think something has to be done when you've got corrections officers in cahoots with inmates, preying on other inmates, when you have inmates sleeping on the floor, when you have the detainees, like I said, in Kentucky, and we also have locks that don't work, and they're not going to work for 18 months. I mean, that's a major issue.
Why not have the sheriff in charge? At least then there's somebody in charge. I mean, right now, I think it's under the Department of Public Safety, and the sheriff's an elected official. Put the sheriff in charge of the jail. I thought he made sense.
Well, thank you very much for giving us that insight to all of you. Appreciate it very much. Bill, don't go away. You and Wendy are going to talk to Clay Dunagan from the St. Louis Pandemic Task Force and the Chief Medical Officer at BJC, who will join you on Next Up. The rest of us will see everybody next week at this time. Thanks, everybody.
Donnybrook is made possible by the support of the Betsy and Thomas Patterson Foundation and the members of 9PBS.
And we welcome you to Donnybrook Next Up. Bill McClellan and I are so happy to welcome tonight to the program the acting head of the St. Louis Metropolitan Pandemic Task Force and the Chief Medical Officer for the BJC Health System, Dr. Clay Dunagan. Welcome, Doctor.
Wendy, thank you very much. I'm happy to be here.
Well, the Delta variant and the news associated with the Delta variant has probably already changed since our introduction of you 5 seconds ago. Where are we today, this afternoon, Thursday, July 29th, in your opinion?
Well, we're on a pretty steep growth curve in terms of cases in the region, and that corresponds with pretty rapid growth in the number of people we have hospitalized and in our ICUs. We're roughly a third of the way back up to where we were at our peak over the holiday season, and we're really not seeing any signs yet of a blunting of this rise. So I suspect in 4 or 5 weeks, we'll be back up to the same levels we saw in November, December.
Doctor, let me ask you a grandparent question. My wife and I are both vaccinated, early vaccinations, and we have grandkids that we see all the time, 10 and 6. They're too young to be vaccinated. And I hear all sorts of different things about, well, you could infect the children even though you're vaccinated, or they could get it and infect you. And we've already flown to Orlando, Florida to go to Disney World and everything before this Delta thing sprung up. Am I supposed to change my behavior now vis-a-vis my grandkids who are going to be going to school soon?
No. That's a really tough question. It is absolutely true that you could get the disease and pass it on to them. We're seeing more breakthrough cases with Delta than we saw with the preceding variants. And right now, I think in St. Louis County, we're talking to the public health department there. They're saying 16, 17, 18% of cases are breakthrough cases. So it's certainly possible to catch it. The individuals who've been vaccinated who get COVID active cases typically aren't as sick. And I don't want to see anyone get infected, but I think the risk to kids is still relatively low. We've seen higher hospitalization rates with this variant than we saw previously for pediatric patients. And we're seeing more spread in kids, but I think they're still at relatively less risk than the rest of the population.
Doctor, would you mind explaining in layman's terms for our viewers and for your two colleagues here today, what exactly is breakthrough? We hear it all the time. I think some people are a little misinformed when it comes to breakthrough.
Sure. So first of all, just backing up one step about what the vaccine does. So these vaccines were designed to keep people from getting significantly ill, winding up in the hospital and dying. They weren't really designed to prevent infection. And without going into the science of it, it's not completely surprising. That they have been so effective at preventing infections has been a really noteworthy thing that I think many of us were very happy about. But the truth is there are always going to be infections. What we've taken to saying is that if someone has been vaccinated but still gets infected, we're calling that a breakthrough case or breaking through the vaccination.
Okay. Doctor, what about the mask mandates that we're talking about? I just have a sense you're going to get pushback from both directions suddenly. I mean, there's the people who have been against it all along and don't want to wear masks and against the vaccinations. And you got people like me who are saying, I'm tired of going through this for those people. If they don't want to wear a mask, they don't want vaccinations, fine. But I don't want to have to keep masking up. How are you going to try to sell this idea to people like me who are just tired of it?
We're all tired of it. I'm certainly tired of it. I certainly like to put my mask away for good. There's a couple of parts to that. So first of all, in the current surge we're in, we're not adequately immunized. We haven't had enough people who have either gotten sick or been vaccinated to stave off another wave. So we're going to see a big wave of infections. Even if everybody who's unvaccinated went out tomorrow and said, okay, I'm ready, I'm going to get vaccinated, we're not going to be able to do anything in time to mitigate this upcoming wave of disease. Masking is really the only thing we can do to blunt it. And we both want to blunt it because we don't want people who are potentially susceptible to get infected and die. But we also want to blunt it because we're really maxed out in terms of health system capacity right now. We're scrambling to catch up for care we didn't deliver in 2020. And we were pretty full before COVID started. With a wave like we had in December, we'll have to start foregoing healthcare needs that might be postponed And we'll also put pressure for more emergent care because we'll just have emergency rooms that are overcrowded and floors that are filled up with patients. So we've got both the personal issue about protecting the individuals who might be vulnerable, as well as the issue of keeping the health system functioning normally.
And is it true, doctor, that even though we have had the vaccine, which, as you point out, it isn't a cure. It doesn't mean that we're not a carrier. We can still carry the Delta variant to someone, even if we have had the vaccine, we can still act as carriers to somebody.
Yeah. Couple of things about that. And the language, it's convenient to talk about carriers, and I hear that a lot. Technically, people are not carriers. So that would be, the famous Typhoid Mary story where she had it in her gallbladder and she kept giving people typhoid. This is more having an unrecognized infection. So someone who has been vaccinated could get infected, and then in the window period of a few days to a week, they could shed virus and give it to somebody else. It wouldn't be an indefinite thing, but there would be that time period where they could be a risk to someone who's more vulnerable.
And they could be so you're saying they, like with the first wave, they could be asymptomatic and just pass it along, even with the vaccine.
That's right.
Okay.
Okay. Doctor, if the goal is vaccination, wouldn't it be better to have something like, let the private enterprise do it? If a restaurant wants to say you need to show your vaccination card to get in, then I'll go to that restaurant. If they say, hey, everybody's welcome, I'll probably stay away from there. Yeah. It just seems like the mask mandate doesn't work to increase the vaccination rate.
Bill, I think that's a good insight, and I think there is this challenge that when you're telling a large group of people to do two things they're not very excited about, it's right. You risk them saying to heck with it. I'm not going to do anything. Again, the goals are different. The mask mandate is to try to tamp this down so we don't max out the health system, while vaccination is about trying to get us to a point where the disease stops circulating. And I think, everybody would like to see COVID gone once and for all. The idea of private enterprise, I'm sorry, my light just went off in my office. I'm not moving enough. The idea of private enterprise weighing in on this and helping, I think is great. I'd love to see businesses say, we'd like to see your vaccination card in order for you to come in here. I think that would also face some significant resistance from people.
Wow.
If you're just joining us, this is Donnybrook Next Up. Bill McClellan and I are visiting with Dr. Clay Dunagan. He is the Chief Medical Officer for BJC Health Systems, and he is the Acting Director of the St. Louis Metropolitan Pandemic Task Force. Doctor, because we're all learning more than we ever dreamed we would learn about a pandemic, is there any way in, lacking a push for, increased vaccination rates, that the Delta variant could become stronger over time or more dangerous to people's health than it seems to be right now? Or are the death rates as high, or the ICU rates as high as they were a year ago right now?
Let's see, a couple of parts to that. So first of all, viruses mutate all the time, and we see it with influenza and other viruses. And they, some variants are more sinister than the ones before them. They make a virus more infectious, or they make a virus more virulent. It causes more symptoms. Typically, the ones that sort of emerge and take over are like Delta, ones that can be transmitted more easily. That's the big advantage, because the more people you can infect, the faster it spreads, and that sort of dominates the equation. There's, without wanting to sound apocalyptic, there's always the possibility that Delta or another variant could have a new mutation that would make it even more problematic, make it spread faster, make it cause more serious disease. The thing that we can do to mitigate that is to stop circulation. And again, that means vaccinating with a vaccine that works for the existing strain. If you could do that quickly, then you really can greatly limit subsequent mutations. It's going to be difficult to get to that level as fast as we need to, however. We'll have to see if new variants arise that are worse than the Delta variant, but we do know we'll see other variants in the future.
Okay. Doctor, what's the latest on kids? Well, I mentioned it early on. Like I have a 10-year-old and a 6-year-old who are over here even as we speak. Are kids going to be vaccinated soon, or are we not supposed to worry about children? Or what's the latest on kids?
Okay, yeah, thank you, Bill. There are several issues there. First of all, at present, we are seeing more pediatric disease than we did. I think as of this morning, Children's Hospital had about a dozen patients in with kids in with COVID, which is more than we ever saw in the previous waves. That said, kids are still much less likely to have serious disease and serious infections. So we haven't reached a critical threshold where kids are the real danger signal. I don't know, you probably remember a few years ago, we had a flu strain that was particularly virulent, killed a lot of kids nationally, and COVID has not taken that turn. So that part is feeling okay for the moment. Kids are, though, quite capable of transmitting it to others, including their grandparents or to family members who are immunocompromised or to other families where they might have someone at risk. So that is a potential problem. In terms of vaccines, there are studies going on. I think based on the track record we've seen for these vaccines so far, I expect them to be effective and well tolerated in kids. We're just going to be some months away from having the data in hand that will allow the FDA to approve them for that use.
Well, as a follow-up to Bill's question then, what is a grandmother or grandfather to do if there is still that risk, even though we're not sure how much of a risk it is at this moment? What do you recommend they do when you see your grandkids all the time?
Yeah. Well, I have 9 grandkids of my own that I'm getting ready to see soon. So this question is present in my household as well. I think there are some general rules. I think being with them outdoors is much safer than being with them indoors. So thankfully it's summer and that's fairly easy to do. If you're going to be in close contact with them, honestly, the safest thing is to be masked, is for you and your grandkids to be masked, particularly if they've been with a lot of other people whose vaccine status is unknown, or if there's a day camp they've been into. There've been a fair number of outbreaks this summer in camps that kids have been going to. Having said that, I know it's tough. It's really hard to be with a grandkid and have a mask on. Surprisingly, or maybe not so surprisingly, they seem to adapt to it better than we do. It doesn't seem to really matter as much to them. But the bottom line is to be safe with young kids that you're not living with regularly and who have been seeing others, you probably need to wear a mask.
Okay. And what about going back to school? You think kids should? I mean, it's almost August, in the middle of August, late August. Kids go back to school. Is this going to be a problem, do you think?
Well, it's going to be a problem because I think the population and our citizens are having trouble accepting what looks like the most prudent advice. What we learned in the last wave is that schools are pretty good at keeping people from getting infected. Even when there were cases at school, they seldom led to more than a couple of other people being diagnosed with COVID. So they know what to do, but we need to give them the instructions to go ahead and take those precautions, which include things like masking. I think it's really important that kids get back in school. I don't have any argument about that, but I do think masking would be appropriate until kids can be vaccinated.
Dr. Dunagan, as a scientist, as a physician, you have the Herculean task of protecting the health of your patients. Did you ever, or have you ever dreamed of a scenario in which you had to also sort of battle back political influences. Have you, just from a physician's point of view, could you share with our viewers what this is like for the scientific community, for the medical community, to see these political divides over something that seems to be pretty straightforward and easy to understand for the good of everyone in the community?
Wendy, for starters, vaccines are truly one of the most incredible inventions of medical science over the years. Vaccines have probably saved more lives than all other medications put together. It's really amazing. And I think, we all take for granted some of the vaccines we have received over our lifetime. We remember being vaccinated for some diseases. I was vaccinated against smallpox, and I was vaccinated against polio. So to the idea, they are incredibly effective at preventing transmission of diseases that can be deadly. There are other cases in more recent developments, such as measles, where the memory in the population of how bad measles can be and of some of the really serious consequences have started to fade. And I think that's allowed anti-vaccination attitudes to flourish. People don't really remember the downside of these diseases before there were vaccines. And in an important way, people who are holdouts against vaccines are in some ways riding on the coattails of the rest of the population that's willing to be vaccinated and prevent diseases from circulating. So this idea of vaccines are incredibly beneficial, but there are groups that are very anxious about vaccination and are opposed on various grounds to them, has been around for a long time. What is unique about COVID is the political identity that some people have associated with the use of the vaccine. And that is a remarkable development because it has no basis in scientific reasoning, for sure. There's no question that getting COVID is way more dangerous than being vaccinated with an anti-COVID vaccine. Nor does it have necessarily a religious bent. It's not, for many of these people, it's not ethical. It's about a personal liberty and a political identity. And that's a true misfortune of this current age. There's really no reason that we should think about medical issues as political dividing lines. It's been a real heartbreak for many of us to see individuals dying in our intensive care units because they took a political stance against getting vaccinated. And that's just a tragedy that none of us would ever have imagined seeing. On top of that, we're now starting to see some sense of resentment and that medical resources are having to be expended on diseases that are basically preventable from a vaccine. And I think that's taken a different toll on people.
Well, Doctor, what would you propose we do? I mean, educating the people just has not worked. I mean, we still have that solid, I don't know what percentage, but a high percentage, almost half of the people who don't want to do this. And, and the government obviously isn't going to be able to force anybody to get a vaccine. So what would you suggest we do? If education doesn't work, what do we do?
Well, the way this is going, I think most people are either going to get vaccinated or they're going to get COVID. That's sort of the long and short of it. So we'll eventually reach a point where we're at pretty much a steady state with this particular variant. We don't know how many people we'll lose in the interim. We do know that as the disease sweeps through an area, there are certainly individuals who've been sitting the fence that become more receptive to the idea of being vaccinated. And so there will be, I think, some tick up as different parts of the country see firsthand how quickly this spreads and how much danger it puts particularly older citizens and vulnerable citizens. And there will be some pickup. There are, though, some really hardcore holdout areas that I think will eventually just have to experience the virus firsthand. And even then, they may not rue having avoided the vaccine, but eventually we're going to have to get to a point where there's enough immunity to stop circulation.
Dr. Dunagan, certain tourist attraction type areas around the state of Missouri and elsewhere have been designated hotspots. We're kind of in the dog days of summer. People are looking forward to going back to school. And I think there's a little bit of confusion if they have reservations to fly into or to travel to one of these hotspots. What would you say to those families or individuals?
Depends on what their vacation plans are. I think if your idea was to go down to Lake Table Rock and have a fishing boat and go out into coves, you can probably travel safely. Again, if you're willing to wear a mask, you can go almost any place pretty safely. If your plan was to go to a lake and go to a busy poolside bar with 400 of your closest friends, you need to really think carefully about whether you're someone who is at low enough risk to manage through that. And you also hopefully need to think about the consequences of you getting infected and being around other people who might not be so healthy. So I think the plans really matter a lot. I don't want to say there's any part of the country you can't go to, but any place that's crowded and a large proportion of people are going to be unmasked, I think there's a pretty high risk.
How about should I drive or should I fly? Now, in airports, people are masked, but yet you're in that airplane, pretty close quarters. Or is it better to just have a road trip and drive and stay in motels?
I think that's a toss-up. We haven't seen a lot of air travel-related disease. There are people who look for it, but we don't get that history in most of the people that we see with positive tests. And I think, again, if you're diligent with your mask, you can probably manage that pretty well. Interestingly, being in the plane is probably safer than the airport because they've paid so much attention to air exchange and how to try to make sure that to avoid circumstances where particles might be floating in the air. But I wouldn't have too much trepidation about getting on a plane for a long trip. I do think that driving in one way is intrinsically safer because you're in your own domain and you're not with other people. But if it's a long trip, you do have to stop. You have to stay in motels. You do have opportunities to encounter someone who's infected. So there's not a hard and fast answer to that one, Bill.
One of the things that we see on our text line at KTRS, people talking about not wanting a vaccine without FDA approval. In terms of fast tracking that kind of thing, where are we right now, Dr. Dunagan?
Well, no one would call the current process fast tracked at this point. It's really hard for us on the outside of the process to understand what the holdup is. Arguably, these vaccines have been given to way more people than typically ever see another drug before it's approved. So it seems inconceivable that they're going to get to a point of suddenly say it's not effective or that it's not safe. When you read the articles by the people in the FDA, it sounds like it's primarily a bureaucratic process. It's primarily administrative issues that are preventing them from finishing up. Lord knows exactly what those are or when they're going to be finished. I do feel like the FDA has just been a little out of touch with what's happening in the real world. I believe that once it's approved, then there are people who will say, okay, that's the final stamp of approval that this is safe and effective, and I can take it. I don't know what proportion of holdouts that'll be, but it'll be something. And it may also allow companies to start to say, we need to have our workers vaccinated. They serve the public. They're having constant contact. We owe it to our customers to make sure that we're keeping them safe. So hopefully we'll hear soon. I've heard various things, including the president's assertion that it'll be within the next month. But I think, no one really knows the answer.
Doctor, I was reading that that the Delta variant, it can feel just like a cold, especially if you've been vaccinated. Well, of course, my friends and I have all, who've been vaccinated. And as soon as somebody feels the slightest bit like under the weather, I might have the disease. Are there a lot of us that now have had it but thought it was a cold? And is there anything we're supposed to do or check on?
Doctor, excuse me, 30-second warning sign.
Okay. Yeah, it is true, particularly if you've been vaccinated. Delta can look just like a mild summer cold. And I think it is prudent to get tested if you have a sore throat or stuffy nose or feel like you're under the weather. Again, although we know you can pass it on, even if you've been vaccinated, people who have been vaccinated are probably at lower risk of spreading it to others just in general. But summer cold could be COVID.
We thank you all for watching Next Up. Dr. Dunagan, thank you very much for being so generous with your time. Dr. Clay Dunagan is the Chief Medical Officer for BJC Health Systems, and he is the acting head of the St. Louis Metropolitan Pandemic Task Force, joining us with an update on the Delta variant. Keep it right here on 9 PBS, and thanks so much for watching. On behalf of Bill McClellan, good night.
Thank you.
Donnybrook is made possible by the support of the Betsy and Thomas Patterson Foundation and the members of 9 PBS.